Good morning. It's time to get in touch. In Touch is a public affairs show dedicated to improving the lives of Susquehanna Valley residents. I'm Freddi Hammer, News Director at Backyard Broadcasting. Well, the time's upon us when people are heading outside, enjoying the summer weather, but in many parts of the U.S., it's some of the warmest times of the year. And people of all ages, especially adults aged 65 and older, risk dehydration, overexposure to the sun, and lots of potential safety risks during travel and other seasonal dangers. Well, the Centers for Disease Control and Prevention said that during 2004 to 2018, an average of 702 heat-related deaths occurred in the U.S. annually. There's an issue of water safety, and also an estimated 236,000 people died from drowning. So there's lots of health issues and safety issues that we have surrounding summertime. So joining us today is Dr. Jessica Ay-Liff. She's a Wilkes-Barre area medical doctor with MedExpress, and we got lots of ways to talk about avoiding all these pitfalls. Good morning, Dr. Ay-Liff. How are you?
Good morning. I'm great. How are you this morning?
Great. Thanks for joining us this morning about lots of little general tips about the summer and things that we want to make sure that we're doing. Are you a summer person, Dr. Ay-Liff? Do you like to get out and do things?
I absolutely do. In fact, I'm at a summer camp with my kids as we speak, and trying to hydrate and follow some of my own rules today.
Okay, well, excellent. Well, good. You can definitely help the kids and the older adults, depending on how we want to make sure that they're safe this summer. First of all, I guess we want to talk about some general water safety tips. If you're at camp, you're seeing them out in the lake and doing different things, but around here, temperatures are up. What's the perfect time and the perfect way to do these activities? What's the way we should do it, and keep it in mind?
So the biggest thing to keep in mind is that drowning is the leading cause of death for children, particularly ages 1 through 14. So making sure that these kids in particular are protected with life jackets and know how to swim is important. Even if they know how to swim, your older kids may know how to swim, but while they're in the lake or the pool or whatever body of water you are in at the time, you still need to wear a life jacket, as currents can catch you off guard and pull you under.
That's true for the older kids who think, oh, I'm fine. They have that sense that maybe they're indestructible, that the cramps can catch anybody off guard.
Yeah, they sure can. And people don't expect currents and everything in the lake, but it can absolutely pull you under just as quickly as the ocean can. So being prepared and just being cautious and keeping a life jacket on at all time while in the water is the best thing.
You have different rules on different lakes, I guess different game commissions and different departments in the states. In Pennsylvania here, tell us about adults even having those life jackets on board of boats and things. So there's lots of water safety issues there, even with grown-ups.
Yes, and oftentimes adults may not be hydrating as well, or they may be drinking alcohol, which is something that you can absolutely avoid while in the water because, again, it decreases your ability to react. And you may be a very proficient swimmer, but while in the lake, again, that undercurrent can catch you, or you can get a cramp or just get fatigued. So even adults should wear a life jacket while in the water.
I just heard recently, I had a talk with someone from the YMCA, and they said one of their older employees just learned to swim as an adult. So that's something that's rare, but probably there are people out there that don't know how to swim. Those are also some things to keep in mind, maybe learning this year.
Learning how to swim can help decrease your risk of drowning. Some of the other things, never go out in water alone. Mm-hmm. Always be supervised, and that's adults too. You should never go out in the water alone. As I mentioned a minute ago, avoiding alcohol, especially with the heat, the alcohol may affect you more than it normally would, so it decreases your ability to not only respond for an emergency for yourself, but also decreases your ability to watch your children properly. Prepare for weather. Always check your weather radar and have appropriate measures. And then another big help protect your loved ones is learn CPR. Studies have shown that if you can start CPR as soon as a drowning is noted, you have a better chance of improved outcome. So knowing just a basic CPR class could help save somebody's life.
I have taken CPR classes in the past, but not recently. I have been made aware that there's a new technique. If someone only knows an old technique of CPR, is that still okay, or should we wait for emergency crews?
Anything is better than nothing. So at this point, I would say even the old technique is still applicable. But the good thing is there are lots of online CPR classes through the American Heart Association that you can actually take, and it's all online and virtual, so you don't have to worry about trying to get into a class these days, so everybody can be certified.
Those certainly lasted a very long time. It would be nice to do it at our own pace online for sure.
Yes, they are long days.
And I guess here we are out on the water. I just bought a new sunscreen for my face, and I'm thinking, I think I have benefits from that. Sunscreen's definitely something that we need to keep in mind as the sun's strong and hot nowadays.
Yes, every day you should be applying, especially sunscreen to your face. Peak hours, the sun's rays are highest between 10 a.m. and 4 p.m. So making sure that even just if you're outside in general, normal day-to-day wear, you should have a light sunscreen on your face. You should put on something stronger if you're going to be out directly in the sun, and you need to reapply it frequently. Most people make the habit of putting on the sunscreen once and thinking they're okay for several hours. But in general, you should be reapplying that every couple of hours more frequently if you're getting in and out of water. Even if you're not directly in the sun, if you think you're safe in the shade, your body can still absorb those UV rays. So it's still recommended to put on a lower SPF, even if you're in the shade.
Those kind of swim attire that they have for kids, I guess everybody has them now. They're really water wicking, and they're long sleeve. They seem soft and comfortable, but they cover your whole body. They're up to your neck, and I think they're great keeping out of the sun.
They are, and most of them actually, when you purchase them, will have a UVA, UVB sticker on them that shows they protect against those rays as well. So those can certainly help as far as even keeping you cool but protected from the sun without having to reapply the sunscreen quite as often.
As people like me who've been in the sun all our lives, should we start looking for different places on our skin maybe for skin cancer? I mean, that's a concern for sure.
Absolutely. I do recommend seeing a doctor for your yearly exams more frequently if you have health concerns, and either getting a referral to a dermatologist or asking your primary care provider to check the moles. There are some concerning signs to watch for that would prompt a referral and possibly a biopsy of those moles, just to make sure they're not turning precancerous.
Those kind of preventative things are usually a part of an insurance plan.
Yes, typically.
I guess here we are for summer travel. Folks are heading out on the road for things. And have we dropped our guard about COVID-19 and maybe even some other viruses that we need to be concerned about on the road?
I believe some people have dropped their guard regarding COVID-19, but we should not. At this time, we are starting to see an increase in numbers again across the country just with travel. So keeping those precautions in mind, masks for safety, of course, vaccinations as per the CDC guidelines, still social distancing when applicable, but frequent hand washing and overall general health tips can help. But yes, other viruses to be concerned of are, especially with travel, if you're going out in the woods, you need to be cautious about tick bites and mosquito bites for things such as Zika, as well as West Nile virus from mosquito transmission. You have Lyme disease from ticks. So there are other things to definitely be aware of as you travel and you need to protect against.
We certainly need to make sure that we're checking for ticks. I mean, the deer ticks, they say, 30% of the ticks in Pennsylvania have Lyme disease?
Yes, probably at least that across Pennsylvania and even into West Virginia and Virginia have that much. And the ticks this year, from what I've seen, have been incredibly small. They look like a speck of dirt.
Wow.
And I've removed several from my son, and the only reason they even caught my eye was they had just made his skin a little bit red where they had attached themselves. So otherwise, I would have thought it was dirt on a normally active boy and would not have thought anything else. So they are extremely small, and you don't have to be out in the woods to check for them. We've caught some off of us just out in our yard, and we don't live in a rural area. So if you're in the grass at all, then you should be checking yourself for ticks.
That aftermath of Lyme disease, when you let it go for too long, can be very devastating for a system. I've known someone who's gotten very, very sick from that. So catching it early is so important.
Yes, and part of it is once you start to get the symptoms of Lyme, it can overlap with a lot of other illnesses and can be harder to diagnose at that point. You can get the fever, chills, body aches, which could all overlap with COVID. as well as like flu, but like rheumatoid arthritis or some of these other autoimmune conditions.
Oh.
So reporting to your primary care doctor that maybe you've been out in the woods, you may not have even known you had a tick bite, as we see that commonly. People don't even realize because they're so small. But reporting that, you know, you are active, you've been out hiking, or you've been out baling hay or working outside frequently, maybe clearing brush, is a really important part of the history that you should make sure you provide to whoever is examining you.
That's definitely good advice for sure. Here we are working out in the woods or doing things outdoors. My girlfriend here at work has MS, and the heat really affects her. She has to stay out of the heat due to what medication she's taking, and it needs to not have any sun hit your skin, and you're on certain medications. I know she has to consider some of those things. But are there other medications that people have to worry about that they're taking that the sun may interact with in a bad way?
Yes, so the big ones that we always warn people about are antibiotics.
Okay.
So a lot of people get sinus infections this time of year, and you run to your doctor, get your antibiotic. A lot of those can make you more easy to burn and can cause a significant rash. Some of the other things are cholesterol-lowering drugs. We know that can affect your liver and can cause some muscle issues. That's going to be exacerbated if you are out in the heat working and you're not rehydrating properly. You're going to be at increased risk for developing that muscle problem with that. So there are some medications, if you're a diabetic, that you've got to be particularly careful of, just due to the risk of dehydration on your kidneys, as well as the most common blood pressure medicine is a fluid pill or a diuretic. And if you're out in the sun, again, you can get dehydrated. Well, the nature of diuretics is that it lowers your blood pressure by causing you to pee more. So you're going to be at significantly increased risk of dehydration while on those medications.
Certainly ask your doctor as you get these new medications as the summer goes on so that you're aware of what you need to do, I'm thinking.
Yes, that should be a question that you ask them, or even your pharmacist can advise you on that if you should be more cautious. And a lot of times on your prescription bottle, it will have a picture of the sun that's warning you to be careful in the sun with this medication.
Okay, we certainly will. So we're traveling and we have our families along with us, and I guess littler children need more breaks, need more water, need to be more concerned over, parents need to be more concerned over the temperature of their bodies too. They're a little less able to fight it off, I'm thinking, when you get really hot.
Yeah, so kids tend to lose their coolness, they tend to sweat, and can get dehydrated again quicker. Little kids and the elderly population are at increased risk for that. So making sure that you're letting the kids get out and stretch, run around, and drink plenty of fluids while you're traveling is important. Making sure that you do not, I know this is common, and we unfortunately hear horror stories every year about a kid who is left in the back seat. So making sure that you're checking your vehicle every single time you get out, even if you think the temperature doesn't feel too bad outside. Don't leave your child in the vehicle alone, and make sure that the windows are down if you guys are just sitting there at a standstill.
I'm loving the fact that there's cars nowadays that remind you, that have different alarm systems. I mean, it's good to have no matter what, and people shouldn't disable those things.
Right. My car alerts me every time I open the door to check the back seat. So it is definitely helpful. Sometimes it is annoying because you're okay, it's dinging at you until you verify it, but it is an extremely helpful as we all get busy, and we would never intentionally do it, but we do get busy and our child may be asleep and you just get out and hop off and run on to do what you need to do real quick.
Exactly.
So
The buddy system, make sure that everybody's accounted for when you're heading out for fun in the sun for this summer. Are there any specific websites that you particularly like that you can find information about some of these questions we may have about being out in the sun or heat stroke or different things that we may be seeing in our families or experiencing ourselves?
my favorite website and information actually is just the CDC.
Okay.
You can find the best tips and tricks as far as hydration, heat safety, drowning safety, as well as all of the viruses and other illnesses like Lyme disease that we were discussing. You can find common helpful tips on that. I don't recommend searching just any blogs. I do recommend WebMD or CDC for the most accurate information and knowing that you are getting the most current recommendations.
It can be really scary if you're looking at like random websites that don't have any backup from the CDC or any kind of health department.
Correct. That could be any average Joe who's just giving you their experience. And so we don't recommend using those as your main source of information. Using a true fact-checked website is the most important.
All right, that's cdc.gov, and then there's lots of different places you can click, making sure that you're safe and healthy for the rest of this summer. We have Dr. Jessica Ay-Liff from Wilkes-Barre. She's a medical director with MedExpress. Just so grateful for your knowledge about the different things we have to worry about for this summer, and I hope that you're safe and happy with your family at camp this year, Dr. Ay-Liff.
Thank you. Yes, we're staying hydrated so far.
All right. How many ounces of water are we supposed to drink? For our body weight or our ounces? How does that work?
Typically, the recommendation is your weight in kilograms is about how much you should be drinking. On average, for an adult, at least 70 to 90 ounces of water a day. Of course, if you have a history of certain medical illnesses such as heart failure, you're going to want to drink less than that, and your doctor should advise you of this. There are instances if you're young, active, athlete, or hiking, then you should actually be drinking more than that.
All right. Well, we'll keep it in mind and maybe go get a fancy new cup to take along with us to the beach. It's always good to get new accessories.
Exactly. Makes it fun to drink when it looks nice.
Dr. Jessica Ay-Liff from Wilkes-Barre. She's a medical director with MedExpress. Just so grateful that you could join us today on In Touch.
Thank you.
In Touch is locally produced in our studios at 1685 4 Mile Drive in Williamsport. To get in touch with us regarding questions, comments, or topic ideas, call weekdays between 8 and 5, 570-323-8200. You can also write to us at 1685 4 Mile Drive, Williamsport, PA 17701. Attention Freddi Hammer. Or email me at fhammer@backyardbroadcasting.com. For archive programs of our In Touch series, you can subscribe to our YouTube channel, Backyard Broadcasting. Each current weekly program is featured on the Backyard Broadcasting websites. Individual opinions expressed here don't necessarily reflect the opinions of the management or staff. Thanks for listening to In Touch, a production of Backyard Broadcasting.